Welcome to Doctors on Call. I'm Jenna Miller. It is estimated that doctors of chiropractic treat more than 35 million Americans each year. This includes the adjustments of both adults and children. Even infants can benefit greatly from chiropractic adjustments. Many times a chiropractic visit is the result of an injury. Any injured patient is 28 times less likely to undergo spinal surgery if the first point of contact is a DC rather than a surgeon. And while you may be tempted to adjust your own back or that of your friends, it's important to know that chiropractors must complete thousands of hours of classroom, lab, and clinical internships during their graduate school program. Chiropractic care is our topic tonight on Doctors on Call with our guest, Dr. Shelbe Darnell of Restoration Health and Chiropractic.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Shelbe Darnell, DC, grew up in Plainville, Kansas. She earned her bachelor's degree in human biology and her doctorate in chiropractic from Cleveland University of Kansas City College of Chiropractic, graduating cum laude. Dr. Darnell earned her 100 hours of functional medicine and chiropractic family practice from the ACA Council on Diagnosis and Internal Disorders. She has completed more than 300 hours of postgraduate study of diagnosis and treatment of internal disorders. Dr. Darnell recently expanded her chiropractic offices to include Plainville and Stockton. She has also served at KC Core in Overland Park Regional Medical Center. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. Thank you so much for joining us again this year, Dr. Shelbe, and we're going to go ahead with some questions while we wait for those phone calls to come in. First of all, let's talk about how chiropractic care has evolved over the years.
So I know a lot of chiropractors are starting to see or get into like the sports therapy. We're starting to see a lot of injuries around sports. I think that's just because sports are becoming, more prevalent in adolescents and throughout children's lives. And so we're starting to see more injuries there. And so I think overall chiropractic is moving more towards full body muscle involvement instead of just joint manipulation. Which I think is very important for the effectiveness of chiropractic. So I think that is kind of how things are moving.
Okay, and do all chiropractors usually, from your knowledge, do they treat sports injuries?
I think they can. It just kind of depends on what the injury is and if they are treating it as a whole versus just doing the adjustments. I think that would be important to differentiate what you're looking for if you have an injury. I think it's important to think, is this just something that is coming from the joint or is there more involved here? And that is something that a chiropractor should be able to tell you.
Sure. Now, what kind of sports injuries do you treat or do you see?
So I see a lot of knee pain, elbow, and shoulder pain, and then I'm starting to see a lot of low back pain in younger children as well. I say children, junior high and high school age, which is becoming more common of an injury. And let's see, that's really...
Sure. Now, do you, I know there's some debate on when is too soon for a child to start contact sports. What's your opinion on that?
I've never really thought about that specifically. I think that it's really important, no matter what age, that the children or anybody participating in physical activity is stretching really well and warming up. The kids are doing a lot of growing and there's a lot of development happening, so I think you need to take that into effect as well as in the contact sports if there's a possibility for concussion. I mean, we're still developing at young ages, so just being extremely careful and encouraging the stretching and the cooling down and things like that.
Sure. Now, do you treat concussions or can you diagnose a concussion? How does that work?
I can diagnose a concussion. Technically, I do not treat concussions, and so if I believe there's something going on, I will refer out.
Okay, excellent. Good to know. Now, is it important when you go to a chiropractor to know what his or her credentials are?
Yes, I think that it matters about what they have to offer, like the services or the modalities that they have. It's going to vary on every chiropractor and the way they adjust. So if you have a preference, really looking at their websites or even calling and asking. Some chiropractors don't do like a thorough exam or like a thorough diagnosis. They just adjust. So if that is what you're looking for, great, find somebody that does that. However, if you have something specific going on and you feel like there's a lot involved with it, find somebody that does a really thorough evaluation and is going to figure out what the root cause of your problem is. And find somebody that will treat that.
Sure. And when might be a good time? What might be going on with a person that it's maybe a telltale sign to get into the chiropractor?
Any aches or pains is a good time. Your body is telling you something is wrong when you're getting those pain signals. And so seeing a chiropractor then, or if you just wake up every morning with some stiffness, we can evaluate that, maybe find out where that's coming from, what's causing that. If you have an injury, that's a good time to come in and we can figure out what exactly is causing that pain as well.
Sure. And how long can a patient expect their session to last when they walk into your office?
With me, typically 20 to 30 minutes. I do a lot of muscle work, so that takes a majority of the time, and then that also depends on how many areas of complaint you have. So if you just have one area of complaint, probably takes about 15 to 20 minutes. 2 or more is going to take 30 minutes.
Okay, now you've mentioned the muscle involvement a couple of times, so let's talk about that and why you do that as a chiropractor.
Yeah, so in order for a joint to move, there is muscles crossing that joint. The muscles go from bone to bone in order to move your entire body. And so by just adjusting a joint, we are getting mobilization to that joint, but also if we don't address the structures around there, I think you're prone to having that fixation again. And so I focus on relaxing those muscles, and that makes the adjustment more effective. It makes it last longer, and it also makes it less painful if there is any pain involved.
Now, we talk about the thrusting of the adjustment and whatnot. Do you sometimes only do muscle work without that adjustment?
Yeah. There are some times a patient comes in and a muscle is so tight that I'm like, I think that is the only thing that's causing your pain. This joint is moving well. I always check. There are some patients that don't like to be adjusted, and so if they let me know that ahead of time, I always try and find a way to make some type of progress with them without the joint mobilization.
Very interesting. Now, maybe a odd question, if you will, would be what do you prefer a patient to wear? Can they come in their street clothes? What do you prefer them to wear for you to get the best adjustment as possible?
Yeah, so you can come in your street clothes, especially if you're coming, from work or somewhere where you don't have time to change. Loose clothing is ideal because then I can move you however I need to, and it makes my work easier, but I can do it no matter what you're wearing.
Sure, and sometimes you'll hear that chiropractic care can be addictive. Mm-hmm. Is there any truth behind that?
I do think some people do like getting adjusted, and I think that's okay. As far as maybe the thought that once you start going to a chiropractor, you can't stop going. They always want you to come back. That is really dependent on the chiropractor as well.
Sure. Now, I'm going back to the muscle work you had mentioned. For somebody who's never experienced that, is it similar to a massage, or how does that work?
It is similar to a massage. I start with what's called instrument-assisted soft tissue mobilization. Some people know it as Graston or Factor. And so I use that as a metal tool, and I use some lotion, and it looks like scraping the skin, and it can break down any adhesions that are built up there, and it also just kind of warms up the area. And then what I do is long sustained pressure on those muscles. What we're trying to do is break back down that tightness that has been built up over a period of time. And so it is similar to a massage. I would say I go slower through the muscles than a massage therapist does. But other than that, it is somewhat similar.
Okay, we're going to go to the phone lines.
Okay.
We've got a caller waiting to ask a question. This is Aiden on the line from Hutchinson. Hi, Aiden. Go ahead with your question for Dr. Darnell.
I want to play football, but my mom thinks it's too dangerous. What do you think?
as a parent, I would listen to your mom. You know, it's really patient. You know, parents are in control there. And I would say if there's a way to maybe do non-contact and see if there's, you know, a way to do that. But yes, listen to mom.
Hopefully mom's watching right now. Okay, thank you for your call, Aiden. Also, do you provide urgent care for your patients? If something happens, you know, very quickly, do you provide urgent care?
Yeah, I can provide urgent care. There are some times where a condition is way too painful for me to do any of my muscle work or adjust. And I actually had a really interesting case last week with that. It was a lady came in very, very tight, in tears. It was so painful. And I actually was able to send her to Second Wind IV in nutrition and Hayes. And so what she did was she went over there and got evaluated by their providers, and she was able to get a Toradol shot. And then she came back to me and we put some heat on it in between, and then she came back to me within an hour, and I was able to work on it, do my full muscle work and adjust, and I thought that worked perfectly. So I would suggest maybe before getting adjusted from another provider, making sure those muscles aren't in a spasm and you really relax through treatment. That would be helpful as well. But yeah, sometimes it is very painful.
Absolutely, wonderful, that's amazing. Now, if a patient needs x-rays, are you able to order those?
I can order those. A lot of times I will just refer out, like where I am at, I'll just refer to the health center and send Brooks County Health Center and send them out there, and then their providers will get those x-rays done for them.
Sure. And then do you get a better picture by looking at what's going on through the x-rays?
Yeah, chiropractic care is gentle and conservative, so a lot of times it is safe to perform through a lot of conditions. However, there are some times that we need to look and see what's going on, or if we're treating somebody and we're not getting the results we want, we need to look and see what's actually going on. So there are times that we need to get imaging done.
Sure. Now, do most chiropractors usually accept insurance?
Yeah, I think it's definitely chiropractor dependent. There are a lot of chiropractors going to just cash practices, but there are still a lot of chiropractors, I would say, in this area that still accept insurance.
And what is the reason behind that, just doing cash?
Yeah, there's reimbursement issues, like low reimbursement for the providers. There's also a lot of, I would say, kind of hoops you have to jump through with insurance, make sure documenting is okay. There's time spent billing and coding, chasing down any rejections or denials, and then eligibility checks for patients when they come in.
Sure, very interesting. Now, what can a patient expect from you when they come in to see you?
Yeah, so the very first visit, we go through all of the intake paperwork, and then we evaluate and try and come up with a root cause or a diagnosis of what's going on. And then the first day we will do treatment. So I do that muscle work that I was talking about, and then we adjust. Every time after I treat a patient, I sit them up, ask how they feel, see if better, worse, no change. Sometimes there is no change, but I always try and make progress with each visit. And then I give them at-home recommendations for them to do while they're not in my office in order to keep that healing going. And then I send them out the door.
Mm-hmm. Now, would you say you typically see patients weekly, monthly, or does it just depend?
It definitely depends. It depends on what brought them, if it was just an acute injury or if it's something that's been bothering them for a long time. The ones that have left it go for a long time and have struggled with it for a while do take more visits in order to decrease their pain. But sometimes in an acute situation, we do treatment and it only takes 1-2 times and their issues resolve.
Interesting. Now, with our lovely cell phones that everybody's on all the time, you'll hear, the term text neck, or that people are having neck problems. First of all, is that a real thing, and what should we be doing to avoid that? Yeah,
so it is a real thing, definitely. Like when you have your phone down here when you're sitting, you're coming forward. I don't think it's just from the phones though. We have a lot of people doing computer work. And so when you're looking down at your desk trying to type things in, or your monitor is down, you can have that same issue. It's just that whole idea of the neck coming forward. And so posture is a really big issue there. So making sure we're sitting up or bringing things up to eye level so you don't have to look down. With my people that do desk work, I always suggest bringing the keyboard closer to you so you're not reaching. That'll bring those shoulders back as well as the mouse. And then the screens up higher.
Now, let's talk about what can happen if a person just continually is looking down and, what eventually happens.
Yeah, so you have a curve in your neck that is, if you're looking at it from the side, it curves up like this. So when you're looking forward, that curve starts coming down and you're recruiting other muscles in your neck to keep that posture. And then you're also straining the muscles in the back of your neck forward. So whenever you come back up to neutral or when you're sleeping, that will all tighten back up. And then you're gonna get that stiffness feeling that I wake up every morning and I can hardly move my head. It's stiff, it's painful. That will start occurring, but you can, over the course of time, create a bigger problem, which is that curve, instead of being curved, becomes flat and you don't have a curve.
Okay, very interesting. Something that we should all be preventing.
Yes,
I'm
especially
happy.
with the young kids, those desks that are so close to them in school, it's becoming more and more of an occurrence where that even like the mid-back curve is starting, instead of having this curve in the mid-back, it's getting larger. So just encouraging a good sitting up posture is important.
And is it important to take breaks if you're having to look that way, to take breaks here and there?
Yeah, I think at least getting up, even if it's not even going for a long period of time standing up, but at least getting up and moving every hour if you are at a desk job or in a prolonged position is really important.
And you mentioned children. Is chiropractic care safe for children?
Yes, it is. I've seen even week-old babies that have colic, constipation, gas, gentle adjustments for the infants is really effective.
Sure. And then on the other end of the spectrum, what age of range towards, an older person do you usually see, or do you see?
Yeah, it's usually safe for all patients. One thing we want to take into consideration in the older generation is their bone density. And so as long as we're healthy and it's safe and it's usually gentle.
Sure. Now, can a person who's had back surgery, are they safe to see a chiropractor?
Dependent on what type of back surgery. So if there's a fusion, we're going to stay away from that area. Any surgical like the rods or anything like that, we want to stay away from. Otherwise, it usually is safe.
Sure. And we had mentioned in the intro about people trying to adjust themselves or trying to adjust their friends. What are the dangers behind that?
Self-adjustments, especially whenever you put mobility into that joint that's not specific, you can cause those ligaments to lengthen at lengths that they're not supposed to be, so you can cause hypermobility, and over the course of time that can really damage those ligaments. You also get that feeling of I need to continually pop the area, and so although you can make an area pop and that might give you some relief, that is not technically an adjustment, because what we're doing with an adjustment is putting motion back into a joint that is fixated, and so that's not, sometimes when you adjust, that's not that specific joint that's needed.
Sure. And people who suffer from fibromyalgia or chronic pain, are you able to, what kind of things can you do to help them?
Yeah, a lot of times there's a lot of tightness going on with those kind of conditions, and so we address that muscle tightness, we adjust any areas that they need to adjust, and they usually see a good result with that.
And can patients benefit from chiropractic care that suffer from migraines or headaches?
Yes, so there's a lot of muscles that are running up in the neck and that attach to the base of the skull, and that pulling on those muscles can cause headaches. And so loosening everything up and getting the neck moving like it should does usually provide relief for them.
Okay, and what is e-stim therapy, and is it something that you offer in your practice?
Yes, electrical stimulation similar to an at-home's TENS unit. So what it does is you put the pads on the area of complaint on the skin, and that activates the muscle and it fires it over and over again. And what that does is kind of numb those pain receptors. And so it's really good for pain relief. I like to do the e-stim and then do the muscle work still, so that we're getting a change in the length of those muscles as well.
Sure, and you mentioned an at-home TENS unit. What is that and how is it used?
So it's similar. You have pads, you put it on the skin in the area of complaint, and then it's a little handheld device, and you turn it up. It kind of feels like tingling at first, but then you bump it up to the intensity that you can stand that's not painful, and so it will numb those pain receptors.
And what patients might benefit from something like that?
Anybody that has a muscle related complaint, so low back pain, if you have upper back tightness and things like that, you can put that on the area. You can use it really anywhere for pain.
Sure. Now we've mentioned children, we've mentioned older adults. What about the benefit of chiropractic care for pregnant women? Can you help them?
Yeah, so it's really important, and especially in pregnancy, you'll hear a lot of women complain about that sciatic pain, that pain going down the legs. When you have that growing weight in the front, the muscles in the back tend to tighten in order to keep you up straight. And so we can deal with that type of pain. Also, it's important to keep the pelvic aligned for the birth, and that it's called Webster technique. We look at leg length and we check the way the pelvis is aligned and take care of any issues there.
Sure. Now, we were also talking about all the hours that are put in when you're training and when you're going to school. What all is required to actually become a doctor of chiropractic?
So, chiropractic college is 10 trimesters, and it's a lot of anatomy. There's organic chemistry, there is pathology. We did take a pharmacology class, X-ray. We learn how to take an X-ray, positioning X-rays and what you can see on those. But yes, tons of anatomy. And then about at the start, about trimester 3, you start adjusting and learning how to adjust your classmates. And then you move on to what they call is student clinic, and you can treat anybody within the school. And then you move on to outpatient clinic. So unlike the MD profession, we don't have a residency. We do all of that work within school.
Excellent. Now, after you're done with school, then what?
You can choose to start your own practice. You can choose to become an associate. The VA clinic is actually offering chiropractic internships at some of the VA clinics as well.
Okay, excellent. Thank you so much for joining us tonight on Doctors on Call. That's Dr. Shelbe Darnell from Plainville. On our next Doctors on Call, our topic will be pain management with Dr. Bell from Great Bend. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.